Melissa, thank you. The face of the heroin user has changed, and right now it's often people from more affluent communities, and that would be teenagers and people in their 20s who manage to hide their addiction.
As the Eye Opener's Emily Reamer shows us, that means treatment programs have had to alter their approach.
We'd all go and steal one of our parents' beers.
It felt innocent, experimenting with alcohol in the 8th grade, but for this local girl who we're calling Elizabeth, it was just the beginning.
By senior year, I was doing opiates and harder drugs.
Halfway through her senior year, Elizabeth overdosed for the first time.
There were like times when you wake up in an ambulance and you're so ashamed that you're at the point you are.
Elizabeth went to detox. She OD'd again 2 days after being released. Eventually, she ended up in ARMS, an outpatient recovery program at Mass General Hospital.
No family is really immune to this, unfortunately.
Dr. James McCowan is a clinical psychologist on the treatment team.
We see people who are ready to change through people who aren't really sure if they have a problem at all.
ARMS works with people ages 14 to 26, even if they can't stop using. The patient helps guide their treatment, building a plan specifically for them.
Individual therapy, group therapy, having a stronger sober support network.
Dr. Amy Ewell says the focus goes beyond sobriety. To treat the addiction, you have to address other factors.
We have so many kids with co-occurring psychiatric illness who need support for that as well.
And a key to this program's success, the family is heavily involved.
Really, they experience really traumatic events, and they need a lot of guidance and support of how to deal with that.
This program helped Elizabeth understand her addiction and learn that simply opening up to her family can help her survive.
If I didn't have the mom that I had, I would have never gotten into treatment.
ARMS does have a waiting list, and they prioritize patients based on their risk. You'll find information in the opioid crisis section of our website. Emily Reamer, WCVB News Center 5.